West Texas today is trying to get a handle on a surging measles crisis, now up to a whopping 124 cases, according to the Texas Department of Health. What started in Gaines County on the state's panhandle has spread to 8 other counties, from Texas's northern tip to Lubbock, a county of 300,000, as the number of confirmed infections has doubled each of the last 2 weeks. How alarming do you find that rate of spread?
The rate of spread is alarming, but also not surprising. Measles is literally one of the most contagious viruses that we know, much more contagious than COVID or the flu.
Texas health officials say of the 124 confirmed cases, more than 100 are patients under 18 years old, and a mere 5 cases involve those who are vaccinated. Frightening for parents like Karina Perez from Lubbock, whose 18-month-old daughter is immunocompromised.
If you don't vaccinate your children, we will run into them in those public places.
Spanning the nation, neighboring New Mexico has 9 cases, Georgia 3, New Jersey 3, and Alaska, California, New York, and Rhode Island have all reported at least 1, though those numbers are almost certain to climb.
We've been seeing a disturbing increase in the numbers of people who have not been getting vaccinated.
The CDC says 2 rounds of the MMR vaccine, usually given by the age of 6, is 97% effective against the virus. But those with immunocompromising conditions or those with higher exposure can still face elevated risk from a pool of people who aren't vaccinated. While the national standard for vaccination is 95% or higher, the reality is much lower for many states. Only 11 actually reach that mark. And in Gaines County, Texas, the vaccination rate hovers around 80%, creating ripe conditions for more infection. All right, so if you don't know your vaccination status, here's a quick primer. For anyone born before 1957, diseases like the measles were so widespread that most in this group are naturally immune, so you probably don't need to do anything. From 1957 to 1968, the vaccine was not as effective. It wasn't a live virus, so you should get a second shot. From 68 to 89, the guidance was only 1 shot, so you should consider an additional dose there, too. But guys, in short, anyone who is immunocompromised or pregnant should consult their doctor first. The crazy part about this, in 2000, measles was declared eliminated in the United States. Yeah. There is a world now, it's not likely, but there is a world where that could change.
Eesh. All right.
It's hard to believe
it's insane.
We're talking about it. It really is. All right, Sam, thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.